There are two ways the female reproductive organs are visualized during a sonogram: transpelvically and transvaginally. A transpelvic sonogram is visualizing the organs from on top of the pelvis, while a transvaginal sonogram, also called an endovaginal sonogram, is visualizing the organs from within the vaginal canal. The female reproductive system includes the uterus, fallopian tubes, ovaries, and cervix. Sonographically, the uterus is hypoechoic with a hyperechoic endometrium. The fallopian tubes are not visualized unless an abnormality occurs. The ovaries appear hypoechoic with anechoic follicles. The cervix appears as a thin tubular structure extending from the body of the uterus to the vaginal canal. The menstrual cycle consists of 4 phases. The first phase is the menstrual phase where bleeding occurs. The first through the 5th day is when bleeding occurs and the endometrium measures around 2 to 4 millimeters. Days 5 through 9 are considered the early proliferative phase where the endometrium measures 4 to 8 millimeters. Days 10 through 13 are considered the late proliferative phase where the endometrium measures 6 to 10 millimeters and the 3-line sign is visualized. Each phase that occurs during days 5 to 13 correspond with each phase of the ovaries. The second phase of the menstrual cycle is the follicular phase. This is when multiple follicles within the ovary mature until one follicle becomes a primary follicle, which is also called the Graafian follicle. During the third phase, which is the ovulatory phase, the endometrium thickens to around 11 millimeters, and the mature Graafian follicle releases an egg. This process is called ovulation, and it occurs on day 14 of the menstrual cycle. The last phase of the menstrual cycle is the luteal phase, which is also called the secretory phase. This occurs during days 15 through 28. The endometrium is the thickest at this point, measuring 7 to 14 millimeters. The 3-line sign blurs away as the Graafian follicle forms into the corpus luteum. When color Doppler is applied, a low resistance in the corpus luteum cyst is visualized. During luteal phase, the corpus luteum secretes progesterone and estrogen to thicken the endometrium in preparation for implantation. When implantation takes place, progesterone is secreted by the corpus luteum to create a safe environment for a growing fetus until the placenta takes over at 10 to 12 weeks of pregnancy. If implantation does not occur, progesterone and estrogen levels drop, which triggers the hypothalamus to secrete GnRH, which stimulates the anterior pituitary gland to produce FSH and LH. This starts the process all over, beginning with the menstrual phase. An androblastoma, which is also called a Sertoli-Leydig tumor, is a rare stromal tumor that arises from the secondary sex groups. It possesses a benign and a malignant potential. The potential for malignancy is 10 to 20% of tumors and less than 0.5% of ovarian neoplasms. This tumor usually occurs in women under 30 years old. It is associated with estrogen production, but also produces testosterone, which leads to the common clinical presentation of virilization in 30% of patients. Sonographically, an androblastoma tumor appears as a solid, hypoechoic mass within the ovary. Any maternal family history of cervical, endometrial, or uterine cancer may be encountered during a visual exam of the ovaries with an androblastoma tumor. Sonography aids in diagnosing an androblastoma or any other tumor by locating where the tumor lies and determining the size of it by using calipers for measurement. It also can show if the tumor has blood flowing to it or not. Location, size, and blood flow are very important in determining if the tumor is benign or malignant, and at what stage it is at during the sonographic exam.